welcome everyone. So in this episode, we have a great guest. We are going to discuss about muscle mass and aging. And our guest is working in Liverpool John Moores as a lecturer of nutrition. Ladies and gentlemen, please welcome our guest, Dr. Richie Kirwan. Welcome.
Hi, Ollie. Thank you very much for having me today.
Yeah, nice to have you. So should we start? Could you introduce a little bit of yourself and what kind of research you are doing?
Yeah, sure. So yeah, like you said, I'm a lecturer in nutrition and exercise physiology here at John Moores. And my main area of research is looking at the link between muscle mass and strength and how that relates to cardiometabolic health in general, but more specifically cardiovascular health. And then if we get even more specific, how that affects our risk of, let's say, blood fat, blood lipid related disorders. So things like cholesterol, triglycerides, and yeah, basically how muscle mass can protect us from that. And then a lot of my research in the past has been with cardiac rehab. So people who've had some form of cardiovascular disease in the past.
Yeah. So I think it's interesting. We talk about muscle mass. Usually we link it more to muscle performance in a way, strength, speed, but you are looking more like cardiovascular health. So could you tell us a little bit how does those two link together? Why muscle mass is important for cardiovascular health?
Yeah, absolutely. Like you said, a lot of people don't kind of make the connection straight away. So muscle is obviously a very metabolically active tissue, and we know that there's a lot of, let's say, population cross-sectional research that shows that those with a higher level of muscle mass and usually a lower level of body fat are at a lower risk of developing cardiovascular disease in the first place. And even in populations that have cardiovascular disease, we see that those with the highest levels of muscle mass seem to have the lowest risk of death. So there seems to be some sort of a protective effect there. And that has put a lot of people questioning why. Why does muscle mass seem to be protective? And one of the things that we can talk about quite definitively is the effect that muscle mass has on, let's say, blood glucose control. So we know that muscle mass is, let's say, one of the primary sinks for dietary carbohydrates. So whenever we eat anything that contains carbohydrate, we digest it, it gets converted into glucose, it goes into our bloodstream, and that raises our blood sugar very, very slightly. And when our blood sugar goes up, it's an automatic response. Our body's like, okay, we need to maintain this in a very, very tight homeostatic range. So it tries to bring that blood glucose down, and it does that by directing our blood glucose to a few different metabolic fates. So it can burn it, but we can only burn so much at any given time. So the natural thing for our body to do is to try and store it. And if we have lots of nice, active, healthy muscle, we're able to store quite a lot of carbohydrate in that muscle in the form of glycogen. So we can store it there. And if we kind of max out those muscle glycogen stores, then we can also store it in body fat as well. But yeah, having healthy muscle is a really great way to help with blood glucose management. And we know that individuals who are able to maintain healthier blood glucose levels have a lower risk of diabetes and a lower risk of cardiovascular disease, which is actually one of the main causes of death in individuals with diabetes. It's not just dying from diabetes. You usually die of some sort of a secondary condition related to the diabetes, and cardiovascular disease is a big one. So that's one. But then my main area of research is the effect that our muscle mass might have on our blood lipids. So when I say blood lipids, I'm talking about things like cholesterol specifically, and then also triglycerides as well. And there's not a huge amount of evidence in this area. And that's what the research group that I work with here at John Moores, that's what we're trying to figure out. We're trying to figure out how does our muscle mass affect that? Those blood lipids, how does it affect HDL cholesterol, our LDL cholesterol? And maybe we can talk a little bit about those as we speak today.
Yeah, so maybe let's go in the lipids a little bit later. So you said that the muscles are good carb sink, basically. So if you haven't exercised for a few days, so basically you haven't depleted your carb stores in the muscle, how much there is kind of space to store more glycogen or carbs? Do we know that?
So we don't, it's hard to put a very solid number on that because there are so many factors involved. Like you've just mentioned there, if somebody hasn't exercised in a few days, there's a good chance that their muscles are quite replete with carbohydrates. But I think within the context of somebody who's quite physically active, let's say somebody who's relatively physically active every day, we do know that their muscles are more susceptible to taking on extra glucose. And that's basically through, well, in the short term, through the activation of certain pathways, such as the GLUT4 pathway, which primes muscles to uptake more glucose into them on as soon as we eat something and, around the time of exercise. But it's very, very difficult to kind of say, okay, this person who hasn't been exercising for the past few days, and let's say they have been eating quite a full diet already high in carbohydrates, there's a good chance that those carbohydrates are already replete. So it's not going to have a major effect then. But we still know that those individuals with those higher levels of muscle mass seem to process that glucose a little bit better than sedentary individuals, for example, who have lower levels of muscle mass and who aren't exercising at all.
Yeah, I'm not an expert, but for marathon and ultra events, you can do the carb loading. So you can basically go over the base level. So I was maybe thinking of this kind of how much you can go over. Does it happen like in a normal situation when you eat carbs that you kind of get a little bit over and then you can start depleting it with exercise? I was maybe thinking that loading phase, that does it play in normal situations also?
So I think one thing to think about is that we're not always, let's say, at 100% glycogen saturation within our muscles. Okay. And very, very few people will. We will be close to that. And then those who train will be at a higher level. So we do know that training status has a major effect on how much glycogen we have and how much we can store. So if somebody is well trained and has healthy muscles, they can store more. And then if they do consume a few more carbs, they can bring that level up a little bit higher than the average person, or well, considerably higher than the average person.
Yeah. No, that's very interesting. So what are the kind of implications? Everybody should have higher muscle mass, so then their carb control works better. Is that basically what would be the solution?
So if you look at cross-sectional data, you'll see that there is actually a nice trend between what we would say skeletal muscle mass index. And just to give people a bit of context, so a skeletal muscle mass index is the amount of skeletal muscle we have in relation to our height. Okay, so it's not just the absolute number of the amount of muscle mass we have, but we see that there's a nice correlation between that and our our chance of not getting diabetes or pre-diabetes. So basically, the more muscle you have, the better. But I would say that is within the general population. And I would say if we start looking within athletic populations, it's not a case of you really need to try and put on the most muscle you possibly can. And what I would say is that it's more likely the healthier your muscle is. And by healthy, I mean muscle that is active, that is relatively lean, that doesn't have a huge amount of what we call intramuscular triglycerides, so fats that build up in muscle. And basically, if somebody is healthy and exercising regularly, they're going to have healthy muscles. So if you have healthy muscles, you have a relatively decent amount of muscle mass. I'm not saying anybody needs to be Arnold Schwarzenegger by any means whatsoever. But if you're physically active, you maintain a good level of muscle mass, that is going to put you in the best position to help control blood sugar, at least, to the best of your ability.
Yeah, makes sense. And you said about the link between muscle mass and cardiovascular health. Are these studies done usually with the older people, or do you have studies basically the whole lifespan, also younger adults?
So the studies related to blood glucose control, as far as I know, are done from people in their 40s onwards. But then if we look at studies with younger populations, we also see a similar correlation between those who have slightly higher levels of muscle mass and better glucose control.
And how do you see this playing the role? I did my PhD. We had the task that older people need to climb stairs. I think it was 5 flights of stairs. And basically the muscle strength was the limiting factor. So basically the ones who were the strongest were able to do this. So the it was not the cardiovascular fitness that was limiting the stair climbing ability, but it was the muscle strength. So basically, I'm thinking that if you have a lower muscle mass, maybe you don't have enough strength or kind of muscle endurance to do aerobic exercise. So basically, I think it's been shown with the older people that if your strength levels are low, then they are not capable of doing cardiovascular exercise. So do you see this playing maybe as a confounding factor here?
It is a possibility. So let's say if we look at a lot of the research that's done on exercise and cardiovascular health, a lot of it in the past has focused exclusively on aerobic fitness. And there's a very good reason for that. Like, we know that VO2 max, for example, is one of the best independent predictors of risk of cardiovascular disease in the future. So it is a fantastic measure. And we do know that individuals who have very, very low levels of muscle mass, so sarcopenia, and just for anyone who's not familiar, sarcopenia is just the title for the condition where we lose muscle mass gradually as we get older. So basically, from our 30s or 40s, most people are gradually losing muscle mass. When we get into our mid-50s, 60s, that starts to speed up considerably. But one thing to take into consideration with that is sarcopenia is not just loss of muscle. It contains an aspect of something called dynapenia, which is the loss of strength as we get older. And I would probably argue that loss of strength is actually much more important than the loss of muscle size itself. And the reason I would say that is you can actually have a muscle that is relatively large, let's say, if you measure it with DEXA. But DEXA is quite a gross measure of muscle size. You just get this is your muscle here. It looks rather large. But if you, let's say, do an MRI with that muscle, which gives you much more detail, you might see that there's a lot of fat infiltration into the muscle, which is an indicator of poor metabolic health. Okay. And usually when you see a large amount of that fat infiltration, that will also have an effect on muscle strength, because those muscles aren't able to contract as strongly as they should be able to. So what we see is that dynapenia, the muscle strength seems to be a much better predictor of long-term health and cardiovascular health than muscle size. And there are a number of studies that have done, and they've looked at, the one that's quite commonly used is grip strength, and we'll see quite an association between grip strength as a proxy for overall muscle strength. A nice association between that and longevity, and also risk of heart disease. But we've also seen some studies where they've done even more, let's say, specific muscle tests, so things like chest press strength or leg press strength, and again, an association between level of strength and long-term health. So yeah, I would say that I think muscle strength is actually much more important than muscle mass, but you can actually work on both when we think about how to develop those and how to maintain those as we get older.
Good. And when you say dynapenia, you said that it's often related to kind of quality of the muscle, if there's a lot of fat inside the muscle. How much do you see that it's kind of the quality of the muscle, and how much do you see it's the motor control, how well you are capable of activating it? Because if you're not doing leg press ever with the big weights, you're not very good with your legs exerting force in a certain test way, at least. What would you say? What's the kind of the ratio there?
See, and that's a really, really good question that I can't give you an answer to, because we just don't know. We do know that, and that it's an excellent point about the actual loss of motor control as people age. One of the reasons why we see people losing muscle mass and lose muscle strength is because of inactivity, and because people are not actually putting in the work to maintain muscle over time. They're not doing anything that requires a large amount of muscle control and use of those motor units. And what we see is that we actually see a decrease in those motor units over time, and the control of those motor units in older adults. And that also contributes to the problem, because we know that sarcopenia is multifactorial. It's not just people just lose strength for one reason or another. There's a number of reasons involved in that loss of strength over time. And one of those is the loss of the motor unit, and particularly particular types of fiber. So, for example, we see in older adults a particular loss of preferentially type 2 muscle fibers, which are, let's say, what we would call the fast twitch muscle fibers, for want of a better term. And one of the particularly interesting outcomes of that is, if you think about it, those fast twitch muscle fibers are things that we use for doing, let's say, powerful, quick movements. But in older adults, if you think about when do they use powerful, quick movements, a lot of them don't. But if you think about when a situation might arise when we do it, is for something like balance. And if you think in older adults, so older adults are, if an older adult slips, for example, if you and I slip, there's a very, very good chance that when we slip, our type 2 muscle fibers will kick in sufficiently and we'll be able to quickly recatch our balance and we'll be able to stop ourselves from falling. With older adults, because they've got this preferential decline in motor units and in these type 2 muscle fibers specifically, they're not able to catch themselves as quickly and react as quickly. And what happens is we see these older adults falling, hitting the ground, and then another associated condition of sarcopenia is also low bone mineral density, or osteoporosis. And that means if you've got somebody who's hitting the ground with osteoporosis, they've got a greater chance of breaking a hip or breaking a bone. And we then know that people who break a hip in later life are at an elevated risk of death within 1 year of that happening. So it's a very, very, there's a lot of cumulative conditions that come along with sarcopenia, and that can kind of really contribute to a lower quality of life for these individuals for a long period of time.